Welcome to Business and Society. Hi, we're really happy to have you here today. This is Michelle Menard and Vernon Menard, and they are from Choice Translating. And this is a company that deals with interpreting documents and all of this to folks that need this type of interpretation. And what I'm really curious about is I realize you started this business from scratch. And so could you tell us a little bit about why you decided to get into this business and how you went about creating a company?
Sure, and thank you, Rosie, for having us here today.
Thank you.
Excited to be here. I started Choice Translating in 1995 while I was a student here at UNC Charlotte.
Really?
Yeah, it's been a while now, but and the idea was given to me by someone that I worked with at the time, who knew that I was raised speaking French at home, and that I was doing a degree in international business in French here. And when he gave me the idea for the business, I had that famous, that aha moment where you see this. I saw this flash of pictures, and I had all these images in my head about what the business would be like, and I knew that that's what I wanted to do. And for me, the business made sense. That idea to start a translation company, because I had a passion for languages and cultures, an interest in business, and I also wanted to have control over shaping my future and also being able to make a difference in the world. And so within a few months, I did the legal paperwork to officially start a business. And so in 1995, in May of 95, we were in business. And in the early days, I worked with my mom, which was fun and interesting, and challenging too, but interesting. And then, fortunately, another turning point for us was actually when I met Vernon around 1997.
I'd moved to Charlotte, North Carolina from Seattle, Washington. To big change.
Big change.
Yes, big cultural change.
Yes.
To start a manufacturing company in the data communications industry. And I'd been referred to Michelle and Choice Translating to translate my marketing and sales literature for my export clients that were a big focus for me at that time. We became, over the course of those initial months, good friends, and eventually I invested in the business. We felt that my manufacturing background would help the company scale in size, but at the same time we would be able to protect the vision and the culture that she'd created for the company.
Yeah. Well, as I understand it, your company focuses primarily on healthcare translating?
Well, we do provide interpreting services for healthcare, but we work with a number of different industries. And as Vernon was talking about the vision and the mission of our company, our vision for the world is a small world that's connected and a better place to be. And our mission is to help companies maximize global opportunities and reduce risk due to miscommunication. And so even though we originally started working in business together and having a business relationship, we also then later got married and have a daughter together. But I'm excited about the business today as I was back then in '95 because we're still helping clients succeed overseas and succeed here at home.
Well, that's wonderful. I was looking at this code of ethics that exists for interpreters. I was really impressed by it. All kind of values: confidentiality, respect, dignity, privacy, accuracy, so on. There were so many kind of principles that I wanted to know which ones are most fundamental in your opinion.
Yeah, and the Code of Ethics actually fits on one page, so it is relatively concise, but all the items on the Code of Ethics are equally important, and they really set the foundation for the training that interpreters need to be effective interpreters. But three that stand out are interpreting accurately, so knowing that interpreters, when they're dealing with different cultures, they have to still convey the meaning of what's being said and interpret everything that's being said. They have to keep everything confidential, and that's especially important when you're working in smaller communities, whether it could be the Hmong community or the Cambodian community, for example. They also have to keep an impartial attitude when they're interpreting and remain neutral, and that's important because sometimes non-English speakers might ask the interpreter for advice. What would you do? Would you have this procedure done? And the interpreters are in a powerful position because they speak multiple languages and they understand both cultures, but they have to remain impartial in that scenario. And there were some more, with the Code of Ethics, having that as a foundation really ensures that they can be trained to be able to interpret accurately. And there was a study recently that just came out talking about the challenges of working with an untrained interpreter and a trained interpreter.
It was really interesting because they quantified the impact of errors that were made by trained interpreters, highly trained interpreters, compared to errors that were made by less trained or untrained interpreters. And what they found is that for interpreters that had very little or no training, they could be volunteers, they could be hospital staff. The errors that they made were, but I would say the study said that over 20% of the mistakes that those interpreters made could have had a negative or harmful impact on the patient. On the other hand, the errors that the highly trained interpreters made, only 2% of those errors were likely to have a negative or harmful impact on the patient. Furthermore, they found that the highly trained interpreters made many fewer mistakes. So the total impact of that training was very obvious then.
Well, I think that's important because there's been much controversy, at least in the medical arena, about using family members as translators, especially children. And I've always found that very awkward when they ask a child to communicate to the parents because of all the dynamics and crossing that line, as you mentioned, between advising and providing the translation. Yeah,
well, and the terrible position you put the child in. Please tell your mother that she's got terminal cancer.
Or that she's dying.
Right.
Or to just basically give the child instructions that are really over their head in terms of trying to interpret it.
Absolutely.
And so on. Well, before you came here, you were telling me over the phone about some cases that you found really, really difficult. So I jotted down some notes about 3 of them, and I really want to put you folks on the spot. And one of them, now let's see if I've got this right, involved a human resources manager of a local manufacturing company who requested a price quotation for translating its entire human resources and safety procedures and so on. Well, yeah. And after they received a quote about how much that would cost them, the human resources manager, and this made me chuckle, said that the price was higher than she had budgeted, and why couldn't you just translate the last page of the manual, which was sort of the acknowledgement of receipt and understanding. You know what I mean? Just sign-off page, having not been able to read any of the rest of it. And Michelle, why didn't you think that this client would be a good fit for your company?
Yeah, well, it's a challenge because, number one, when we're translating something, we want to make sure that the audience understands. And so to be asked to translate just the acknowledgement and understanding page versus the entire training and safety manual is a little disturbing because we want, you know, when we're working with companies that their employees are obviously trained and get the information, whether they speak Spanish or Vietnamese or whatever language, just like the English-speaking employees have access to that information. So that was a little daunting. But at the end of the day, we can help clients when they're trying to budget for translations. We can help them through that process and looking at, well, how long did it take to do that in English, to create it, how many people reviewed it, so we can help them with that process of budgeting for translation. And then also, what trainings did you do for your English-speaking employees? So how can we carry that over to your non-English-speaking employees so that they are also being safe in the workplace and not getting injured in the workplace? And were you going to add something else to that, Vernon?
Yeah, the trouble that the ethical trouble that we had with that is that a company was making sure that they were covered from legal liability in the case the Spanish-speaking person's arm got cut off, but on the other hand, they were investing in making sure the English-speaking person's arm wasn't cut off.
Right. Right.
So
Yes, very unfair.
yeah, so
you
that
know,
it didn't align with our values. And
No, not
so we
with that
preferred
code
to
of ethics.
we preferred to stay out of that.
Yeah, very wise decision. I was thinking how difficult it must be, for example, or even costly to translate one of those long informed consent documents. Uh, you know, the temptation, well, first of all, many people who read them don't read them and they just sign them. But to translate one, have you done that?
Yes, we've translated a number of consents over the years, and a wide
Particularly for clinical trials,
For
Yeah.
clinical
drug
trials,
trials and
yeah.
treatment trials.
and a wide range of documents. And when clients are looking to get something translated, it's really thinking about, you know, who's the audience and how is it going to be used. And then from a budget standpoint, is there anything that we can do to make the document more internationally friendly at the beginning? So that wouldn't work so much for a consent document, but on the other hand, if it were a training manual or an instruction manual, perhaps some of the lengthy text could be replaced by some diagrams or some charts. So then it makes it less, you know, less wordy to translate. So it's more cost-effective to translate it that way. So there are different strategies that we can do in working with clients so that to make a document easily translatable, so that the message is getting across accurately, and that it's on budget for them.
I recently saw a document that had to be first of all created and then translated for people with cognitive disabilities, and they used a lot of pictures and charts and so on that really, actually I said, I wish they would do this for me, because finally I could understand, you know, what was going on in a very, very complicated type of protocol. All right, so I can't resist now, Vernon, since we're getting to know each other better here, another case for you. And this was when a nurse called, and she said she had a little problem on her hands.
She did.
And she suspected that a homeless, uninsured man who had had an operation at the hospital or whatever was an undocumented immigrant, all right? So she was thinking about this, and the hospital wanted to discharge him. No money was coming in, no money was going to come in, and so on. And he didn't want to go. And obviously, probably the reason he didn't want to go was he had nowhere to go. And so the nurse said, look, just help me. All I want you to do is translate for me the following words. If you don't find yourself a place to go, we will have you deported.
Indeed.
So you didn't want to do that.
Well, first I want to say that in the Charlotte region, the major healthcare networks do a fantastic job complying with, or doing their best to comply with Title VI of the Civil Rights Act, yes. However, the real life situations on the ground day to day are complex, and staff sometimes find themselves in situations for which they're not perfectly trained or educated. So we work very, very closely with the administration of healthcare providers to resolve those kinds of situations and help with education and training whenever these things come up. So I wanted to say that first.
Right.
However, this was one of those situations that required education. The nurse faxed over the request to translate this sentence, if you don't find a place to go, we'll have you deported. The patient didn't want to leave because he didn't have a place to go, and second of all was concerned about follow-up care. He didn't have any access to that, so he was in a predicament. But the nurse obviously was concerned about her facility too, and they weren't prepared to deal with it either. And she was trying to solve her problem the best way she could figure out. So I called her on the phone. We talked in the office about who was going to handle this, and I got the short straw. I got the short straw. But so I called her on the phone, and I explained that handling the issue or approaching that issue that way might not be in the best interest of her facility for a number of reasons. Firstly, it's illegal. Secondly, it would be a public relations nightmare for her organization if any immigrants' rights organization found out about what happened, and it could result in a costly lawsuit also. And so I suggested maybe she think with her management about other ways to approach the situation. And I also talked with the director of that facility. As I mentioned, we work with the management to try to resolve these kinds of issues in a quiet, respectful, and constructive way, so that we're all focusing on solving the same problem together. And the director was very appreciative of my input and ended up resolving the issue in a legal and compassionate way. So
I think it just shows that everyone's really trying to provide the best possible
Yes.
care.
Yes.
But the reality is some of these issues are complex.
complicated.
And there's limited resources, and that can lead to a lot of frustration in the workplace. So we're thankful that that we can work with our clients to not only look at what other trainings we can help them to provide, because they may have thousands of employees, not just hundreds of employees, but thousands of employees that are needing to learn about how to deal with diverse populations.
Right. I mean, what you were getting into was not only an issue of translation, but an issue of helping the man figure out where to go and so on, and implicitly demanding that the institution figure out some way to safely discharge him.
And protect people's dignity.
Yeah.
Yeah.
Yeah, I mean, what the nurse wanted to do was, in effect, issue a threat, and that's kind of sad.
Yeah.
But like you
But
say,
it was
people,
resolved perfectly.
well.
Yeah,
Perfectly appropriately.
and I think the intentions, although receiving that fax was a little bit shocking, that I think it was the intentions, even though the words weren't there, that the intentions behind the words were good.
Good.
It was just a result of some frustration, and,
Right.
and kind of being stuck on, okay, how do I
Right. Things can get very
how do I deal with this?
frustrating. I agree.
Exactly.
But it had to be handled delicately, because the results could have been disastrous for that person.
Right. That's interesting. Well, let me ask another question. Now, this one, if I get it right, there was a doctor who had a patient. The patient said he couldn't speak English, but the doctor said, yes, you can speak English. You're just sort of faking it. So your translator got over there and basically said, this man really can't speak English.
Right.
I mean, what did the interpreter do, or how did they
Right.
handle that?
We've been in business 17 years now, so we see such a wide range of scenarios on the appointments, because we have interpreters out in the field, every day of the week, every day of the year. So, but this one was also another one that kind of
It was a
took us
surprise.
aback a little bit. But we had, the client had requested an interpreter for this patient. It was documented in the system that the patient had an English language limitation and needed an interpreter. So when the appointment was scheduled, the interpreter arrived early for the appointment, but surprisingly the patient and the provider were already meeting. Everyone had gotten, was ahead of schedule, they were already meeting. And so when the interpreter went in the room, the provider, let him know that he wasn't needed. But as the interpreter was looking at the patient, the body language of the patient clearly showed that the patient didn't understand what was going on. And the purpose of this appointment was actually a pre-surgery consult,
gosh.
and to go over, what was going to happen with the surgery and how to prepare for surgery. The usual, not to eat anything, not drink anything within a certain amount of time, etc.
Because there are serious complications
Because
that
there-
can
if
result
you
if
do.
if the protocol is not followed.
Right. And so when the interpreter realized that that the patient didn't speak English, he intervened with the provider and said, I'm here to interpret. And the provider was just very insistent that the patient did in fact speak English and should be able to speak English. And so there was obviously a cultural competency, a cultural awareness that was lacking there. And surprisingly, the provider was an immigrant. So that was
From a non-English speaking
from a
country.
non-English speaking country, so it was surprising. But the interpreter, again, kind of stepping more in the role, in this case, of advocate, to be able to make sure that the patient is able to get the care needed. The interpreter intervened again and asked to be able to interpret, and the provider was still again insistent on just going forward, and that the interpreter could leave and go help someone else. And so the interpreter stepped out
Before then, though, he actually verified by asking a direct question to
That's
the patient,
true.
do you understand?
Yes.
And the patient said no.
Yes, no, I do not. I do not understand. That's true. Thank you for clarifying. And so the interpreter, politely, went out of the room and then went to a supervisor there and was able to come back in with the supervisor and kind of resolve that situation. And then the provider was, working with the supervisor to get additional training and information about
Right.
how to be, culturally appropriate and culturally sensitive, and the importance
Yes.
of being able to accurately communicate.
Yeah, that's a very complex situation. We keep getting back to this issue of the translator, the interpreter, being neutral and not being an advocate. I can imagine that.
That's the fine line.
The fine line. Do you have other instances? I mean, I would find it, for example, very difficult as an interpreter when I see something going on not to intervene. I mean,
That it's very important. It's very important to maintain objectivity and maintain both parties or all participants in an interpreting session to trust that the interpreter is going to be impartial. However, if the outcome is being jeopardized at some point, the interpreter then is allowed to advocate or intervene in a way that can get things back on track. And I think, Michelle, you have a great story that can demonstrate that, where confidentiality is still being protected, but the interpreter was able to intervene indirectly, but very effectively to save a situation that was in jeopardy.
Yeah, the interpreter had interpreted a number of appointments for a patient who had previously been in a gang. A gang. Yep, we have that here in Charlotte as well.
Yes.
As much as we don't want that to happen. And he had, through the course of some previous appointments, had shared, and it was interpreted that he had taken illegal drugs in the past. And so during this particular appointment on that day, the provider needed to find out if the patient had taken drugs previously, because that would hinder the treatment plan going forward for this other scenario that he was dealing with.
It could have been dangerous.
And in
Medically
fact,
dangerous.
if he had taken illegal drugs before, then this new treatment plan would be very detrimental to his health going forward. So when the interpreter is here interpreting and the provider says, have you taken any drugs previously? And the patient very quickly says, matter-of-factly, no. And in the interpreter's head, as the interpreter, of course, his voice, he's interpreting everything that's being said, but in his mind, he's thinking, oh my goodness, I know that's not accurate, and now I have the dilemma of knowing this information that's confidential, but if I don't share it, then what's going to happen to the patient's health going forward? And so the interpreter, again, acting very strategically and carefully, then realized, okay, in order to not divulge confidentiality, I can, as the interpreter, ask the provider to ask the question again and to explain the reasoning behind the question. And so then the provider asked the question again, have you taken any drugs previously? And then why that was important. And then fortunately, the patient then said, well, yes, as a matter of fact, I have. And so they were able to find a new course of treatment for him.
they were able to find it. And the confidentiality was preserved? I mean,
Exactly.
right. I mean,
Exactly.
and they didn't report him or any of that kind
No,
of thing?
no, so everything
That
went
very, very,
very well.
smoothly.
It could have gotten off track,
Yeah.
but thankfully it stayed on track.
Yeah. Can you think of other ones? I mean, I'm really fascinated with this ethical tightrope.
Well, I think, coming to mind now, not necessarily, but I think in trainings that we do and focusing on the code of ethics, what's important for people to realize is you can be bilingual, you can even be bicultural, but it doesn't mean that you can be an effective interpreter. And so to make an interpreter effective, they really have to have a lot of training to do what they do.
I think that's a great distinction.
Yes.
That I used to speak Czech when I was a little girl, and so on and so forth. But just because you're bilingual and bicultural really doesn't mean that you're a good interpreter.
Right.
That's right.
And the same is true also on the translation side. We've kind of
Yeah.
talked about both types of skills today, but interpreting is an interpreter is someone who focuses on the spoken language and verbally, and this is done by telephone, by video, face-to-face or in person. But on the other side, there is document translation. And these are translators who tend to focus, they're on the written words, they're working in their homes, they're all over the world.
It's not contextual in the same way.
And they also have a little bit more time to
Right.
find the exact word, but they also have to be certified, and they have to have training and the skills there to be able to translate accurately, or the message can be completely
Right.
missed.
No, I think you bring up a great distinction between translators and interpreters, and between doing something just from paper as opposed to doing something on the scene live, so to speak. You know, we really don't have that much time left together. So is there any message you want to communicate to our audience about your industry, about what's the most important thing about it or service it provides?
Well, really, this is a program about
Yeah,
ethics, and for us, it's important to do our work correctly, accurately, because it's important to do the right thing. It's not specific to our industry.
Right.
It's just how people should be. But whenever an organization has language or cultural obstacles to overcome, they have a choice to make. If they tackle those issues head on, then they're going to have an opportunity to reduce costs, reduce risk, and have better outcomes.
Michelle,
Well,
still a minute.
Yeah, well, there was a wonderful study that just came out recently that actually looked at CEOs from global companies, and it asked them, okay, why do you think you're losing business opportunities overseas, or how have you lost these contracts overseas? And one of the things that they said was a primary reason, I think almost 50% of the time.
49% of the time, the CEOs said that they lost big international deals because they did not have the language and cultural competence in their organization. And that 85% of them said that they would have greater revenues, greater market share, and increased profits if they had the resources in-house.
That's amazing. No, but it also goes to show the kind of world we live in and the importance of being culturally aware and
Indeed.
culturally sensitive, and to be able to provide these services to people, especially in Charlotte. I mean, we are growing to be a very diverse population, more and more as people come because they see opportunities and a new style of life and so on. Well, we really want to thank you for your time today.
Thank you so much.
It's been fun, and I think you've really told the audience quite a bit about an industry they might be quite unfamiliar with, the interpreting industry. Thank you, Michelle and Vernon.
Thank you.
Thank you.